Hello and welcome to HEALTHLINK TV show with me Stella, your host and your midwife. Today we'll be discussing something that affects a lot of women, dysmenorrhea, also known as painful menstruation, which by its nature affects women's quality of life. Let's go for a breather. When we come back, we start our discussion on dysmenorrhea.
Dysmenorrhea is one of the most common affecting young women in their reproductive years. It affects approximately 40 to 70% of women of reproductive age, with 10% of women describing severe symptoms. Dysmenorrhea can occur a few days prior to menstruation as well as during menstruation, but normally subsides as menstruation finishes. Whilst pain is frequently considered a normal symptom in the menstrual cycle, excessive pain or pain which leads to decreased ability to carry out normal daily activities is abnormal. The degree of pain that may be tolerated by individuals varies greatly, and thus dysmenorrhea is a highly subjective disorder. As with other pain conditions, the cause appears to be multifactorial and involves inflammatory mediators, pain pathways, and a centralized response. Many women will obtain relief from a combined individualized approach to treatment, reflecting the likely multiple underlying mechanism.
I believe that all women menstruate except pregnant women. Some may experience dysmenorrhea, others may not also experience dysmenorrhea. And doctor is here to explain why some people go through a lot of pain during menstruation. Doctor, you are welcome.
Thank you very much.
How are your patients?
They are doing well.
Doctor, what is dysmenorrhea?
Okay, dysmenorrhea, as you said, means painful menstruation.
Okay.
Sometimes we may use the word menstrual cramps. These are all synonyms. But the long and short is that whilst you're having your menses, there's some kind of pain, which sometimes may start before the actual menstruation, during the menstruation, or even after the menstruation. Okay. Yes. But for dysmenorrhea, sometimes we want to know why it's going on. So we tend to have two main types of dysmenorrhea. Okay. We have the primary and the secondary. So usually for the primary, it occurs mostly in young women, adolescents, and all those in their puberty years. Okay. So those ones, usually there's no disease condition in the lower abdomen or the pelvis, but they still have pain, especially during their menstruation. Then the secondary dysmenorrhea, that one is usually because of a pelvic mass or a pelvic pathology. That is a disease in the pelvis of the woman. That is why they are having pain during the menstruation period.
All right. And how will I differentiate normal menstruation from dysmenorrhea? Like, what are some of the signs and symptoms of dysmenorrhea?
So with dysmenorrhea, like I just said, there is pain either before the menses itself, during the menses, or after the menses.
Wow. What causes the pain after menses?
It's all because, before you can actually have pain, studies have shown that there's this substance that are produced by the body that causes the womb to contract. So once it contracts, it's like there's shortage of oxygen or blood to the organ there, and because of that, there's ischemia or pain. So it's a substance that is causing the pain. But some women may experience it, others may not. It all depends on the levels of the substance in their system. So that will determine whether you're going to have very severe pain, or you may not even have any pain at all. And sometimes because of different pain thresholds, people have different pain thresholds. So for some, they may have pain and it can affect the quality of life, as you said. Some people can even become incapacitated, like they cannot go to work, they cannot go out, they just stay in bed because of the pain.
Right. You mentioned two types of two categories of dysmenorrhea.
Yes.
That was the primary and the secondary.
Yes.
So what causes primary dysmenorrhea and what causes secondary dysmenorrhea?
So with the primary dysmenorrhea, that one usually occurs in adolescents or women less than age 20. And this one is as a result of ovulation. So normally we say the menstruation or the pain that they are having is as a result of the fact that they have menstruated. Because when they do menstruate, there are certain substances that are released into the system and that can cause the pain. But for the other group, the secondary dysmenorrhea usually is as a result of a pelvic disease that is causing the pain.
What are some of the pelvic diseases that can cause secondary dysmenorrhea?
So usually pelvic disease such as pelvic inflammatory disease, that's an infection. You could have a condition we call endometriosis. Okay. What that one means is that you have the endometrial glands, what is supposed to be in the womb, outside the womb. Wow. So it can cause a lot of pain. Then even fibroid can cause it. Okay. Then some people, they may have ovarian cysts. Okay. All those ones can cause it, yes. So these are some of the common causes of secondary dysmenorrhea.
And how do you manage such clients when they visit your facility?
So for those who have secondary dysmenorrhea, because there's always something that is causing it, you deal with that. So if it's a PID, you need to treat it with antibiotics. If it is thyroid, you may have to remove it. If it's endometriosis, we have treatment for endometriosis. So for the secondary dysmenorrhea, you just treat the underlying cause and the patient will be fine.
So doctor, how do you treat dysmenorrhea in your facility?
So for dysmenorrhea, like I said before, you need to know whether it's primary or secondary. Okay. So if it is secondary, you need to deal with a pelvic disease or pathology that is causing it. So if you have a fibroid, you manage it through surgery. If you have endometriosis, there are drugs that we give. If you have a PID, we have drugs that you give. But if it's a primary dysmenorrhea, because that one we don't have any pelvic disease that is causing it, there are some medications that we give. You know, I mentioned that the pain is as a result of certain substances that are in the blood that causes the pain. So we give certain drugs that will work against those substances. So we have medications such as NSAIDs. They are painkillers that we give. Then we even have combined oral contraceptive drugs. We actually have contraceptive drugs that we give that also helps to treat or manage the dysmenorrhea, because you know that most of these dysmenorrhea that are caused by the primary ones are because of ovulation. So if you can stop the ovulation, you know that you can minimize the pain that happens during the menstruation process.
Are there some home remedies for the treatment of dysmenorrhea?
Yeah, so there are certain things that can be done in the house. One of the most effective one is what we call the hot water bottle. You know, you can actually get a hot water bottle. We have specially made ones, but most people may improvise. You get a bottle, you put hot water inside, then you put it in your lower abdomen. And what that does is that it helps to circulate the blood around the area, and when it happens like that, it diffuses the pain. So it's like your mind is more on the hotness of the place but not the pain, so it just diverts your mind away from the pain. Some people also avoid taking in milk because they say when they take in milk they have a lot of pain during the menstruation time. Then for some people, they eat fruits, they take in a lot of water, or even during the menstruation process, they exercise a lot. So some of these things can help to reduce the pain, especially for the primary dysmenorrhea. Yeah.
Okay. How will I know whether what I'm experiencing is primary dysmenorrhea or secondary dysmenorrhea?
So the primary ones usually occurs in very young women, adolescents, puberty, teenagers, those usually less than 20 years. And that one, you don't have any pelvic disease. So once we rule out any pelvic disease, then we know that your dysmenorrhea is the primary type and usually occurs during ovulation. So once there's ovulation, you have your menses, you have the pain. So it's more like a cyclical problem that you have. So that one will help us to know whether it is primary or secondary.
So meaning I can't figure out whether what I'm experiencing is primary dysmenorrhea or not unless I come to the hospital. Right?
Exactly.
Okay. How can we prevent dysmenorrhea?
It's difficult to prevent it, but what we have noticed is that women, when they get pregnant, of course, when you're pregnant, you don't menstruate, so there's no pain. Yes. Then those who give birth also, usually we realize that after childbirth, the dysmenorrhea, usually it minimizes or even it disappears altogether. Yes, and the reason is that normally when you deliver, there may be some damage to some of the nerves in the genital tract. So that means your pain perception and all those things go down. So you may not actually have the pain again. So for most people, then of course when you go into menopause, that one there's no menses, so there's no pain again. Yeah.
But can exercise help someone with dysmenorrhea? Can it reduce the pain?
Yes, certain exercises can, because you know that I just mentioned that it's because there's shortage of oxygen around the area. So when you exercise, you help to circulate the blood. Once the blood is circulating, that means that it takes away the substances from where the womb is. Okay. And as a result of that, it will reduce the pain.
This is HEALTHLINK TV show. Stay with us, we'll be right back.
Yes, I have, but mine is not that severe. I do taking paracetamol, 2 tablets, maybe morning, afternoon, and then evening. Yeah, so it helps reduce the pain a bit.
First, nearby, and I I say, I do tama me baby brand, and I be almost just yet to pin so my asses and sana. Kasaba, a basso to Miss Iami Yaumu, or bra, Mojani Banus, so that's Iami Ya. And see, and Mammy Fa, Iami Yankasa, Iami Yankasa, but me will be an at you call.
But Madame for you, I have me on us nice any or nominate the nurse, no quan or yon. Now be a bit time. I mean, me woo ya no nay, but me woo you know, yet to say. And then Mrs. Baba, and I'm me where a baby kakra 1 day, 2 days. Mrs. Nimba, na jai. Into me, yummy Mrs. are not pin, a jai cra, into me, ya, and no, me, yashi, I just me, yapping killer beer, and one bam, tis a hospital, and I'll be, I mean, yamisa. But me, Madame Mona, or no dear, any or daho, tis a dinner hospital. Answer, ni humbeton.
First day no. It me jai. Sometimes me no painkiller. Sometimes you know, me do fruits na me no nsuo bebre.
Not really, but I know someone who experiences some when she's in her menstrual cycle. Sometimes it starts in the first day. Sometimes it extends throughout. So she takes painkillers when it starts, and then sometimes she uses a hot water bottle. Or sometimes she sleeps with her tummy on the bed until it stops.
Yes, my kid sister, like anytime it comes, she really goes through a lot of pain. So, yeah. She didn't know about the home remedy. So from what I know, I told her to boil hot water and put towel, face towel or anything to put it under her tummy or maybe where the pain is, and it comes down.
Oh yes, I've seen. My ex-girlfriend is also a victim. She's a victim of the menstrual cramp. What we used to do, either we end up at the hospital, or she'll go and take injection. Because without the injection, she can't stand it for even for 30 minutes. So the injection is what sometimes calms it down. So after a day, you have to go for another injection. Or sometimes we use hot water on her abdomen for it to be calming it down until she comes out of the cramp. Yeah, that's how it is.
Oh yeah, like with my girlfriend that I'm with now. Yeah, during its menstrual cycle, she normally goes through a lot of pains. Sometimes when I come around, I couldn't talk to her because of the pains she's going through. And it's not like a couple of days throughout its menstrual cycles. So I even intended to take her to the hospital, but she said that's what she normally experienced from her childhood up to now. But normally, she loves to lie down. She loves to be lonely, always to lie down. And that's what she normally do, but she doesn't take any medicine.
Yes, my younger sister actually. For like, I think a couple of days, let's say 3 days. Well, usually hers is extreme. So it takes a bit of, more medications and sometimes visit the hospital. Yeah. So I must say it's very painful. And today one funny thing is I happened to see one article written by a guy saying that he wished it rather happened to guys rather. So he termed menstrual pain as a coward. So why not he rather face as men but women rather, for us to share the pain. So I think personally it really drains. It really drains, yeah. So sometimes I wonder how ladies manage, work, education, and this whole, ladies suffer a lot. So that's why I say.
Yeah, I've seen it. I saw it with my wife. Normally a day before the menses and some 2 days into the menses. She doesn't take anything. She just endures it till the menses is over.
Yeah, me who be that, but my sister ladies be a complaint so omonya be pain. Libinum say ba, ibinum some for painkillers. Ibon somewhere and deal. It be a first 2 days, Any binum de severe, but if rock on number from Kakra. Matian, but me who with a bet Matilda.
Welcome back. We've been discussing dysmenorrhea. So, Doc, moving on, can painful menstruation affect childbirth?
No, it doesn't affect childbirth in any way, unless there's another disease state or pathology that is causing the inability for you to get pregnant and to give birth. But painful menstruation on its own does not cause problems with childbirth.
Okay. And can sex cause painful menstruation?
No, it doesn't. But sometimes it's interesting to note that some women actually prefer to have sex during menstruation time. And that might maybe help to reduce the pain, because when you have sex and you have an orgasm, there's release of some hormones that will kind of minimize the pain. I'm not saying that people should go and have sex when they are menstruating, but some people do. And it kind of causes the pain to go down.
What about sweets? Can sweets cause painful menstruation?
Some women actually say that when they take in sweets a lot, the following menses, there's a lot of pain. We don't have any clear-cut studies, but it's probably maybe more like an observation or peculiar to those women. Yeah, but some women say that they have a lot of pain when they take in sweets.
Doc, before I let you go, can dysmenorrhea cause excessive bleeding or reduce bleeding?
Dysmenorrhea on its own does not affect the amount of bleeding.
Okay.
It doesn't make it heavy or less. Okay. Usually if you're going to have heavy bleeding or less bleeding, it depends on certain factors. Yeah, so the pain on its own does not cause less or more bleeding. Yes.
Doc, it's been amazing having you here.
Pleasure is mine.
Great. Viewers, I've learned so much on dysmenorrhea, and I hope you've also learned a lot from it. Make a date with me same time next week as we talk about other issues related to women's health. HealthLink, everything on health.
Health tips: how to manage mild dysmenorrhea. Place a heating pad or hot water bottle on your lower back or abdomen. Avoid smoking and excessive alcohol. Recommend relaxation techniques such as yoga. Avoid exposure to extreme cold. Exercise and pay attention to overall physical fitness. Rest when needed. Avoid foods that contain caffeine. Massage your lower back and abdomen. Wear loose-fitting clothing just before and during your period. If you need a painkiller, try an over-the-counter painkiller such as ibuprofen. If there are reasons you can't take ibuprofen, paracetamol may help instead. Your pharmacist will be able to give you help and advice.